Hello, I'm Dean Potter and I'm a pediatric surgeon at Mayo Clinic, Rochester. I'm here to talk to you today about chronic ulcerative colitis in children. Ulcerative colitis is an inflammatory bowel disease that's grouped together with Crohn's disease and typically presents in either childhood or early adulthood. Its most common symptoms include abdominal pain, bloody diarrhea or diarrhea with mucus in that. It can also present with inflammation of the eyes called uveitis, or sometimes inflammation of the joints called arthralgias. If you or your child has developed these symptoms, you might be consulted with a pediatric gastroenterologist. And to make the diagnosis, it requires multiple tests, including CT scans, MRI scans, and endoscopies to obtain biopsy of the colon or bowel. Once the diagnosis of chronic ulcerative colitis is made, it's usually a straightforward treatment program that starts with steroids or other immunosuppressive drugs. Many patients are easily controlled with these medications, but unfortunately a subset of patients do not respond well to those therapies and may go on to more stronger drugs such as Remicade or infliximab. If your child or you have failed this therapy, then surgery is usually the final treatment for ulcerative colitis. Thankfully, surgery can be curative for ulcerative colitis, particularly in the young age group, because ulcerative colitis only involves inflammation of the colon. So as surgeons, we can remove the entire colon and rectum and create a reservoir to make the number of stools per day acceptable. Mayo Clinic in Rochester was one of the first hospitals to perform this procedure. It's called Ileal Pouch-Anal Anastomosis. And we performed our first operation in 1980. And we recently reviewed all of those patients, over 500 patients that have had ileal pouch-anal anastomosis done in Rochester, and the results are very good. Generally, patients will have 4 to 6 bowel movements during the day and 1 bowel movement at night. The function at 30 years is also very excellent, and many people are very satisfied with their results. With that said, it's a very complicated procedure, and if you were to require this surgery, we would recommend that you go to a center that has much experience in the operation. Rochester is one of those such centers. The way the surgery has been performed has evolved over time. Many years ago, it was performed with a long incision, which required weeks of recovery in the hospital. These days, we perform the surgery most generally totally laparoscopic, with the largest incision being about 3 centimeters, or laparoscopically assisted procedures where the largest incision may be about 6 centimeters. The length of stay is in general about 3 to 5 days. I have had patients leave the hospital in 2 days, depending on how well they do after surgery. Again, it's a very complicated procedure. Most generally, it takes 2 operations to get the procedure completed. Sometimes, if a patient is very sick, it requires 3 operations so that they can become healthy after the initial removal of the diseased colon. Again, it's very important to come to a center that has much experience with this procedure, because there are many complications that can occur, and you need to be at a place that is ready and able to deal with those problems.